Hi everyone, today we're gonna show you a procedure called Aquagold or Microneedling. It's a new kind of device that uses a disc of thin needles. They're really hair thin gold-plated needles that treat texture irregularities of the skin. They also address large pores. How does it do that? It causes micro trauma to the skin. And because of that, the body starts to produce collagen trying to heal itself. Also, with this device, we can customize a mixture of ingredients to address different skin issues. Again, like large pores, fine wrinkles, melasma, texture irregularities. These ingredients are attached to the disc of the needles. And as I punch with the needles, they deliver those ingredients into the skin. And what's wonderful about this device, it's not just plain old smooth needles. They actually have grooves that wrap around each needle, and through those grooves, those ingredients are really delivered into the superficial layer of the skin. And again, the mixture can be completely customized. Usually in every mixture I do add a little bit of Botox or neurotoxin, and what it does, it relaxes the teeny little muscles that hold the pores open. So in about 7 days, the pores actually shrink in size, and I think that's the best procedure to actually shrink the pores. For those who have rosacea, their flushing will get better because neurotoxins or Botox does have that effect on the blood vessels. Acne will get better because there is a reduction in oil production. So we're going to start. We have our beautiful patient. She has some large pores that she wants to address and also some fine wrinkling, and we can really get close to the lid margin with this device, and fine wrinkles will also get better. So I'm just going to put my gloves. We're going to keep this procedure clean. My mixture is already prepared by my aesthetic consultant, and this is a little bottle, so I just wanted to show you. So this is the mixture that will be delivered into her skin, and the little disc of needles is up on top. And they're teeny little needles. You can't really see them sometimes well on camera, but they're there. They're hair thin, and again, they're gold plated. Okay. So I'm going to start with the cheek area. It seems to be the least sensitive area. I'm going to start slow so the patient can get used to the sensation. And really it's just kind of a punching motion. How are you feeling? Good. Some areas might be a little more sensitive, like on the forehead. And it takes a few minutes to really do this with little to no downtime. The patient will be pink right after, and tomorrow she can apply her moisturizer, she can apply her makeup. In about a week the Botox will start working and shrink her pores. In about 4 weeks the collagen will be produced, and that's how long it takes with any collagen stimulating procedure. And you see a little liquid kind of on the surface of the skin, but it's also punched into the superficial layer of the skin. And you see she's very comfortable. We did put a little numbing cream to really make it a pleasant experience.
How do you feel it? Do you feel anything?
Absolutely. So the forehead might be a little sensitive. And I'm going to go over the stubborn areas several times to really induce that collagen production or trick the body or the skin into healing itself. I actually used to do this procedure with an old Botox injection in the insulin syringes, and it was much more uncomfortable. This is a much smaller trauma to the skin, controlled trauma. Really faster delivery, and I can add other ingredients into the mixture to really give the patient the best result. You see how close I get to the lid? It will really tighten it. The skin will be healthier looking. The pores will shrink. And it can be done really on a patient of any age, somebody who's younger, who wants to get a little glow before any event, or they have a little acne and they want to improve the skin texture. And that's a little liquid that kind of drips down, but it's also punched into the skin. And again, it's called Microneedling with Aquagold, and gold because the needles are plated, gold plated. And again, the beauty is that we can customize the mixture that can be delivered into the patient's skin to really address any of the concerns like large pores, melasma, dull skin, fine wrinkles, especially around the eye area. So she has a little bit of hollowing in the skin, has a lot of fine wrinkles in this area, so I'm really gonna go over this area multiple times to really improve it. It's a great procedure to do around the holidays. Nobody will really know what you had done, but they will see it different. You should be able to hear compliments. You look refreshed, you look rested, you're glowing, your skin looks so good. And again, the patient is very comfortable. You're not going to be in pain from this. You're not going to scream and want to run away. There is really no downtime, just a little pink color right after. And again, you can start this procedure in your 20s, you can do it in your 30s and 40s. And with Botox, it's a regular Botox that really we inject as well into the muscles to address deeper wrinkles. And it takes effect in a week, just like regular Botox injections. So the patient will start seeing results in about 3 to 4 days. And again, it's great for flushing of rosacea, it's great for those who have large pores, acne, oily skin, fine wrinkles, dull skin. And we really treat the patient until we finish with the liquid. And again, I'm going to treat this area a little more aggressively to induce collagen production. So there is really no bleeding. There's a little pink color of the skin.